Ooh.
Yeah, don't leave the meeting, please. That would be nice if you all stayed. Okay, if you want to put the slides up then.
Yeah,
Julia?
just remembering what to do. Share and there. It's all right.
There we are. Thank you. We're hoping that Lincoln's going to join us today. He's on his holidays, but we're hoping that he'll be able to join us to thank everyone. Okay. Okay, we've obviously got some updates today. Bit of information that's gone on in the last few weeks. It's got a little bit busier, and then we're just going to go over the last year of what's been going on. Helen's here to give us a bit of an update on the Girl Guides, and hopefully Lincoln will join us, and then we'll go on from there. Okay, just to remind you all, please stay on mute unless you're speaking. If you want to speak, then raise your hand. If your signal is poor, we may have to disable your video because sometimes that helps. Any questions, post them on the chat or put your hand up and we'll try and answer them as much as we can. It's an open forum, so please be kind to everyone. Anything else that you would like to ask us, just use our email to contact us. If you have a question, just click on the chat and on the participants, you can click on the hand to talk. Okay, latest updates. Unfortunately, numbers have risen in the last couple of weeks. And on here, the rates 100,000 rates per 100,000 for June is 298.7 for under 40s. Over 40s, it's 67.1. We are seeing a significant rise, but it's still very small numbers for Torbay. So it makes it look like it is a significant rise, but it is still only small numbers. There were 125 cases in the week to the 26th of June. So from 40 the week before. We're still numbers in hospital as of the 29th of June. There were no patients in Torbay, and there's 12 patients in Devon Hospital, 74 patients in the southwest. Numbers have gone up slightly, but not in our direct area. Percentages for vaccinations don't look as good as they were last time, but actually we've got more of an up-to-date number on the population of Torbay, so that's made the numbers look a little bit different, but still doing really well. 50 and over, 92% have had both vaccines, and 73% of everyone. So that is really good. It's 62% in England, so we're doing really well being at 73%. And we're trying to encourage everyone, especially the youngsters, especially with our numbers rising in the under 40s, trying to encourage them to get their vaccinations.
Down here was 70%, 62%.
Key messages: cases are increasing. We are thankfully seeing that it's not significant with people becoming seriously ill. Most, but not all, are in the younger age group. So this is the group that weren't.
Like that.
Sorry, can someone put themselves on mute? Sorry, Simon.
Sorry.
That's all right.
I'm on a building site.
Oh, are you? Yeah, so numbers are very low in the hospital, which is good news. And we're moving to a managed risk now. Winter's going to be challenging because we may come across everything else that we normally have in the winter, including the flu and potential of things like neurovirus, because that's been quite quiet at the moment. We're going to be promoting vaccines, boosters, particularly for the flu, and anything that comes forward with the boosters for the vaccines for COVID, if there is one. But what we've got, most importantly, we've got to remember the hand washing, fresh air, and keeping everything safe. And that's going to continue. I think that's something we need to realise it's going to be part of our life now, and just keeping ourselves safe. Okay, over to you, Julia.
Thank you, Kirsty. So we thought we'd just do a little trip down memory lane for the year from about last November when we first met. It's been quite a year, but it's been a really great year in terms of champions. So we launched in November, as we said, and we've covered lots of topics in the forums and had some really good speakers and some great sort of questions and answer sessions. And a little flavour of these follows. Where we started off, I don't know if you remember all this, sort of Lex and you at the initial sessions, is looking at the basics of infection control and what coronavirus was and how it spread, and that picture that looks like people smoking and it's showing the molecules going around in the air. And this is just an excuse to put one of my favourite pictures on, which is the Swiss cheese model. Do you remember it? So this still applies, it's still as useful as ever, showing how a virus can get through different parts of all the measures that we put in place. But the more measures we have, the better barrier we have. So it might get through your hand washing, and it might get through your ventilation. But then if you've also done the cleaning, and if you've also perhaps got a mask on and your social distancing, something along there is going to help prevent it spreading. So I really love this model, and I think we'll keep using it as much as possible for any more COVID and for future infections, because it's so helpful. We were talking about lockdowns, weren't we? We've had several now. So we were talking about what it would mean for people and how we could keep going without breaking rules, and what the implications are going to be and how it was affecting mental health. So we were talking about that a lot early on and off during the year. And I think one important thing which the Champions exemplifies as well is that things work so much better when they mean something to you individually and locally. So it works so much better when someone you know talks to you about it, or someone you trust is having their vaccine. That makes you feel that bit much more confident about getting it yourself. And we had localized campaigns like, one basal faulty is 2 meters apart, which didn't work with all age groups, but worked with some. And social distancing the Torbay way, 1 beach hut, 1 palm tree. So I think that's just like a metaphor for, if it's local, it's really that bit more meaningful and compelling. And working through you as champions has really been key in that. It's people talking to people rather than government talking to everyone in a much less personal way. And we've had, do you want me to hand over to you, Kirsty? So this is, then we moved into the new year and we got some more formal sessions. So do you want to run through the different ones that we had?
Yes, I wasn't here for any of these ones, but yeah.
So I do the ones you were,
yeah.
You start a bit later? So in January, we talked about vaccination. So that was just starting, wasn't it? December and January, people in the most vulnerable groups were getting their vaccines, and we got someone from the CCG kindly coming to explain the programme. And all the way through all of these, we ought to have a special mention for Simon, who is our intelligence team lead, who's done all the data, and everyone's in all of our forums and all our other groups really appreciates the data, because that's the key thing, showing what our trends look like. And his graphics are lovely. He's got such a brilliant range of different infographics, and the little syringes for the vaccine have been filling up over the months, and that's been really sort of encouraging, seeing how good the uptake has been in Torbay and in wider Devon. Rachel came and talked to us about, Rachel and our team came and talked to us about health and wellbeing, and this was the 5 ways to wellbeing, and how it was being adapted from how it's used normally to how it could be used in lockdown or in times of COVID. And that's so much, the really big thing has been mental health impact of the pandemic, and that's likely to go on for years, isn't it, especially as economic problems and continue. So I think that's one of our big takeaways, is how much the how long the impact is going to last, whatever happens to future infections. And I think everyone in every organisation has been really concerned about the numbers they're seeing, and keeping both their staff and people who come into their customers and people that come to visit feeling more positive with their mental health. And then we talked about testing. We brought in the regular community testing. So up until that earlier in the year, we'd all had the go and get a test if you've got symptoms. Then we brought in the community regular testing, get into the testing habit. And we're still promoting that. We are waiting to see what happens on there should be an announcement on Monday to talk about the what's going to happen on the 19th of July, and then apparently final confirmation on the 12th of exactly what's happening on the 19th. But we're anticipating testing in some forms continuing for some time. And it's been really helpful. We've noticed how it's helped to pick up people who don't have symptoms, and so they've been able to isolate and not spread the virus. So actually the regular testing where people have done it has really helped. What we're facing at the moment is a lot more apathy and people not wanting to do it and businesses not wanting to do it. So all the encouragement we and anyone can give is still really appreciated to keep people testing themselves twice a week, especially if they're going out to a workplace. Is that when you started, Kirsty? No? March, we talked about the returns to school. We've had several mini returns to school with different sections of the community back at school, as you'll know. And then in the March one, we had a Q&A about what were the problems schools were facing, what was the work they'd done to make the places safe so that more and more children could be accommodated in slightly bigger bubbles, and how they were going to keep infections as low as possible and then react whenever they got a case. At the moment, as we just said, we've got quite a few cases in schools because it's hitting the younger age groups more because they haven't been vaccinated. So, and it seems to spread quite quickly because most of the virus we've got across the country now is now the Delta, and it just seems to be rapid in spreading. So we're still facing that issue, but as you will know, there's quite a lot of debate about how schools are going to operate from September and whether we're still going to isolate children or what we're going to do. So we're all waiting to see what happens there. But schools have been absolutely magnificent throughout the whole year in managing remote learning, school learning, isolation, cleaning. They've done, you know, more than 3 jobs really, keeping everything going, and children have been brilliant and resilient coping with it, but obviously it's had an impact on education. This one, you were here for this one.
I was here for this one. This was fantastic. This was really nice and interesting, everything that was talking about long COVID. And Dr. Ginn was talking about how she was affected by everyone she'd dealt with in hospital and how hard it was for the staff, and trying to sort of get people to understand that it's the potential of the long COVID and not knowing how long that long COVID is. And that was really, and obviously it was quite an impact on the statement we had from someone that was suffering that Luke's read out, and that was really good. And I think that was really important for that. And I've passed that part of the forum on to a lot of friends to listen to that one, because I thought that was really was good.
We're still lacking quite a bit of data, aren't we? Because we don't know the full extent of people, the full extent of symptoms, and also how long it's going to last. Because you know, usually syndromes like this naturally come to an end. You can't treat them you can't cure them very well, but you treat them supportively and then they stop. But because we haven't had COVID that long, you still don't know how long people are living with it. So there's so much still uncertain. There's also quite a bit of uncertainty, I understand, about how much it affects young people and children. Obviously it does, but to what extent? And that's one of the things to balance up, isn't it? As we say, okay, young children don't get COVID very badly, but if some of them get long COVID, that's something to think about when we're working out how to manage in schools.
Yeah.
Yeah,
so Jason Garside came along and spoke about what he'd put in place for his resorts and how they were looking at opening up and coping with it, and how he was looking after his staff as well. And it was something we're looking at, especially coming into the summer, where they were going to have the tourists coming down, and how they'd worked closely with environmental health and ourselves to try and support the hotels in the area. So that was really interesting. I had lots of information. It was nice to feel confident that the big businesses were doing this and helping to support what we were promoting. So yeah, that was really good.
The Responsible Riviera programme is really important, isn't it? It's showing how we are all working together, and businesses and hospitality are working together to be responsible and safe. But we also want visitors who come to the southwest and to Torbay to be responsible too, and remember they're not on holiday from good, sensible behaviour. So I think it's a really great programme, and regular testing, if we can get people doing that a bit more, would really help. We had a session also explaining what the compliance officers do. It sounds quite a harsh word, but actually they've been our friendly face out in the community very often. They've had a multiple role. There's only a couple of them, but I think it's been 3. Is that right, Helen? About 3. And they've been supporting places where there's been problems, but for us, they've been brilliant, because where we've tried to contact trace people and unable to get hold of them because perhaps we haven't had a phone number or the phone didn't work, they've been able to knock on the door, put a leaflet through, and the person's rung us straight away, and we've been able to trace contacts and get in touch. And they've also been helpful and offered to put people in touch with support, you know, like pharmacy or food or whatever as needed. So they've been a really great face in our community out on the streets, and that's been brilliant.
And Julia, we've got them till next March, the 3 of them. So
fantastic. And they have helped us out in the last couple of days as well, because we've got larger numbers coming in, and we're having to make inquiries with more people because they're not answering their phones. And they have popped around and seen people, and just to make sure they're well, because that's the other concern, is if we can't get hold of them, that they're very poorly. So it is also just to check on their welfare, and it's worked brilliantly, especially in the last few days as well. So it's been brilliant.
Yeah. We're going to talk about this one a bit later. So this is our brilliant Torbay COVID Champion Guides programme, or more in a minute. There were lots more, but we haven't put them all on. So we hope you've enjoyed them as much as we did, and they are all still on the website, so you can find the resources, slides, and some recordings still on the website. So if there's anything you want to look at or share with somebody, it's still on there and available to have a look. And I just wondered, at the beginning, I think Lex asked people, and Sarah, who's joined us today, I think, on a scale of 1 to 10, how confident are you having conversations with people about good infection control and how viruses spread and what to do? Although it's difficult to keep up with all the changes in guidance over the next few weeks, perhaps, do you feel more confident? Don't say no. Anyone feel a bit more confident on how things spread and what we can do to keep ourselves safer?
I've found it valuable with sharing at work and being backed up by public health and Torbay, and sharing that information so it's not made up or just dragged off the internet. That's been really valuable.
That's really helpful, thank you. Feedback like that is great, because through you we reach so many more people, and there's just so many more people confident and knowledgeable to give good information, which is wonderful. And I mean, obviously this is our last face-to-face session for a while, but messages haven't changed really. Well, you know, our ask hasn't changed, and I'm hoping that we'll all carry on doing this even though we're not meeting. So we've still got loads of networks, each of us individually in the community. We can reach so many people. You can reach it to spread the virus, but you can also reach as many people to spread good information. So the keeping in touch and keeping aware of what the latest credible information is really important, and we will keep supporting you to be able to share good information with other people through the bulletin. And now handing back over. Shall we go to should we hand over to you, Helen?
Yeah.
This is exciting, this is.
Okay. Hello, I'm one of the guide leaders at First Babacom Guides. With my other hat, I've been working for public health, and I'm now back in environmental health, so I've kind of got a bit of a wider remit, really. I did a talk to the forum probably about 2 months ago, 6 weeks ago now, just on what we were doing at our guide unit and our plans. And I've just been asked to really just give a bit of an update on how has it gone, where are we, and anything else that's planned, really. So the answer is yes, it's going really well. We're all really, really enjoying it, and the guides love it, so that's great. In terms of what we have done, we've produced, with the help of Torbay Council, a programme for guiding. It started off as guiding, and now we have a programme for brownies as well, which obviously the younger age groups, because they showed a lot of interest in what the guides were doing, so we decided to progress it with brownies. From the guiding point of view, we are trying to build it in. They have something to call a skills builder at Guides and Brownies, and we tried to incorporate all the different COVID activities within our normal skills builders program. So it's kind of to look at things like improving communication, doing their best, having a challenge, and lots and lots of other things as well. In terms of the main things that we've been doing at Guides over the last sort of couple of weeks, just some examples really. The first thing we really got them to do was to just really have a good think about all the facts they know about COVID, and they had to come back the following week and really just get into groups and kind of give us some facts about where they were on COVID, because we had an idea of what we thought they knew, but it was completely different really. And what they knew, I was amazed at in terms of some of the facts they were coming out with. I was really surprised. So that was a good start. The following week we did a badge competition. So Kirsty, could you show the picture of the badge? Is that okay for the next slide?
There it is.
Okay, right. So what we did, we got the guides to design a COVID Champions badge. And again, they love doing that. This is the winning badge, and it was won by one of our guides, who's one of the younger guides actually. She's fairly new to Guides, and her name is Anna Maddox. So well done, Anna, because we think she's done a fab job. We liked her sort of design because it was quite simple. And it just sort of was quite easy for everybody to understand what it was about, we felt. So that was the badge.
We love it, and we all want one, Helen.
You will. We are getting those printed off. Torbay Council has agreed to pay for the guiding units to have them produced and sewn up and through a manufacturer. And to us, that's really important because the badges do mean a lot, because they all get sewn onto the guide camp blankets. So when we go to camp, they have an array of badges sewn onto their camp blankets, and they're quite important because often they get passed down the generations of girls, so mums and granddaughters. And we've got guide blankets that are over sort of 80 years old, and they've got all the badges from 80 years ago. So we felt this was really relevant, having a COVID badge, because when somebody in 40 years time looks at the guide blankets, they can see the COVID badge on it, and it will remind them of everything that we've gone through as a community with COVID. So that's really important to us. So the other things they have done, they've had a poster competition. So I think we've got a picture of the poster.
Yeah, that's there.
And this poster, again, we thought was brilliant because it just puts out some messages around hand washing, keeping a face covering, and there's little bits about being brave on there as well. And again, this was done by one of our younger guides, and her name is Betty Bell. So well done, Betty, because we thought it was fabulous.
It's absolutely lovely, and I do love that it's be brave and be kind as well as safe and wash your hands and stuff, because it's all part of it, isn't it? It's the being supportive, and really, we've all got to be a little bit brave living through this. So it's lovely. It's beautiful.
And so we thought that was a really good job by Betty. So the things that we've got planned for the next few weeks, as we're sort of halfway through really. So we are planning, this last night we actually did an activity on pressure groups, and so we got them into groups, and they had to come up with a group slogan on how to encourage the population, particularly the younger population, to have vaccines. So they all did little boards on sticks and kind of wandered around giving their messages out as if they were trying to get people to be vaccinated. So that went really well. And next week we're doing a whole session on, which may be quite difficult for some, but we're doing a session on really about their emotions around COVID and how do they feel about the legislation changing and how they're going to feel with everything opening back up fully potentially, and just kind of their thoughts around that and what they're actually thinking about it at their age group. So that's the plan for next week. And we are again, the Brownie unit's quite similar. The Brownie program is quite similar, but just with some slightly simpler exercise and activities suited to their age group really. So And we've got brownie units in Paynton and Brixham now working towards the badge as well. So it's kind of trickling out into other units, which was the plan in the first place. So I think we're along the way of doing that as well, really. So, and I think really in a nutshell, I think the guides have done their best. And I think that's it for me, really. So
I think they've done us proud. I think the young champions are stunning. Has anyone got any comments on or seen any of it happening? I can't see people actually on my screen, but shout if you've got anything to add on that. It's just so heartwarming, but also really useful because it's young people talking to young people, giving them good information that will really make a change. And anything they learn through things like the COVID safe behaviours will also help us to do things like keep our antibiotics working. The sort of having good infection control benefits us in so many different ways, not just in a pandemic. So what they learn now is never lost.
And I think, Julia, for us, it was the messages that they pass back to their family members, because they've been feeding back from what they've been learning at guides. They've been feeding it back into their families. So that again it's slightly wider than the guide group. It's it's kind of going back to all those brothers, sisters, mums, dads, grandparents. So. Yeah,
absolutely. They've got really big networks. Yeah. So it's brilliant, Helen, and we're so in awe of what they do. Is Lincoln on the call? I can't see anyone from here. If not, our most important word to say was thank you. So this slide we've used before is what do champions do? They do a brilliantly good job, and we are just so very grateful for people on this call and on all the other calls and who get the bulletin and have been helping through networks. So for you taking part and being so enthusiastic and having brilliant ideas and helping us to consider topics we might not have thought of, asking questions, and being so committed to helping communities and networks really, and helping us reach so many more people than we otherwise could do. So we are ever so grateful for your partnership, and I do like this one. We've used this a lot, haven't we? But it's lovely. So we're kind of back to what we normally do later on in our sessions. Shall I hand back to you, Kirsty? Some of our usual stuff, or do you want me to carry on? Are you happy?
Yep. Obviously, we've got all the contacts on the link tree, which is it gets sent through to you, I think, also on the bulletins, and we'll continue that. The websites, obviously, there's Torbay Council one, there's the government one, and the NHS. Make sure you obviously check our Facebook page. There's not been a lot going on there. We're trying to get as much as we can on there. Same with Twitter. But obviously there's lots of communications going out at the moment. So unfortunately, we don't always take priority over the more important ones that are going out through the Torbay Council, but we are trying to get as much as we can out through the champs as well. If you've got any concerns, anything that you want to ask us, obviously we've still got the champs. Email will still be there. Just contact us. Our key messages, obviously it's just the normal things. It's the hands, face space and fresh air. I know we're not likely in a few weeks' time to have to wear the masks, but I think it's still really important for us to keep with what we need to do and keeping that in place. And it's just promoting this testing, trying to test, especially with the summer, with everyone coming down to us. We're trying to get people to still continue doing their twice weekly tests, even if they're on holiday, would be great. And working together as a community. And I think this is what this is doing. And even if we're not having the forums, we still have the bulletin, and we can still communicate via the email. And if we find anything that we feel that would be important for yourselves to know and to pass on to your friends and family, we will be sending that out to you. Okay, next few months, obviously, numbers are going up again. So we aren't at the end of this pandemic, unfortunately. And as I say, communication is the key to supporting us through this. And so we're here to help you with that. yeah, so we're going to continue with the fortnightly bulletin. We think there's going to be enough going on at the moment to keep you involved as much as we can, and it will be on likely to be in the future all the other health topics that are going on, especially as you have connections with some of you with elderly community, schools, churches. It would be really important to be able to get that information out to support them through the winter as well. So yeah, I think that's very important. And one of the things that we're looking at is the areas where people are not taking up the vaccines. So if anyone has so what are we looking at with that, Julia? What was the?
I think there's a couple of tacks on the vaccine. One is we're currently in the programme of vaccinating younger people, so that's 18 and above. So we don't yet have evidence that they're not taking it up, but nationally there's a sense that people will be more reluctant or not see it so important to take it up in those age groups, and also that they like different ways of receiving the vaccine. Like they still have the needle, but booking an appointment and going to a site is less likely to get people. So we're having more drop-ins, or you can come as a group with your friends, or a few more of the mobile vaccine units moving around. We're not allowed to call it the vaccine bus now, it's got to be a mobile vaccine unit, moving around to try to go to places where it might be more convenient for younger people to go and just say, oh, well, while you're here, come and get your vaccine. And we're also targeting, we've looked at some areas across Devon where there's slightly lower uptake in different geographical places, not massively but slightly, and also trying to promote uptake in those areas and take the mobile units there. It's partly that people might not be so keen, but it's also partly just making it really easy so people don't have to travel or book or work out how they're going to manage the arrangements, just making it as easy as possible for people to get their jabs. And it will carry on because, as you know, they're planning to do a booster jab, and certainly for the vulnerable and older groups in the autumn, alongside flu vaccination, possibly at the same time, but possibly, you know, very close to. So vaccine programs are going to keep going for quite a while, and we need to keep up the enthusiasm. Everyone was keen to have one this time around, but we have to keep them, you know, if you have your vaccine and you get your booster, we will keep things at bay.
Mm-hmm. And there was we're trying to find out if we've got any contacts with minority groups. Is that right as well, Julia?
Yes, I think if you know any groups where you think either where you've got good contacts or where you think people are less keen or have been just accessing vaccine clinics less, please let us know. If you're happy to let us know, and perhaps to help put out the messaging, that would be great. Or also why people are not taking up vaccination. So is it because it's not convenient? Is it because they're not keen? Any intelligence you can give us and any support with getting messages out is really valued. So keep your eyes open and let us know on that one. Yes, please. That's it. I will stop share. Anyone want to say? Are you? Sarah was there. She's gone,
Sarah had to go, unfortunately, at 1.
All right, because Sarah did some of these sessions for a while. Anyone want to say anything or share anything or make suggestions about what we keep people informed about, what topics we talk about in the future?
Hi.
Hi.
I think just the general things that you do ordinarily to keep us updated on. I've got the contacts with schools and a local church, and I do a newsletter after each forum. And I just think sort of giving people everyday information, because I hear people talking at the school and their mentality of having the jab or not. I pick up things, don't say anything at the time, but get back to them at a different time because I know who to target. And I think it's just knowing your audience.
Yeah.
You know, it's, you know who you've got to be sort of tread carefully with, and I have got a good rapport with the school. So I just think, you know, just sort of understanding and listening to people's views, and, you know, but I would like to keep getting the information so that I can keep doing these fortnightly sort of information newsletters, because people are actually taking notice at the school, and then I email it onto the church, Banfield Church as well. All Saints Church in Banfield Road. So people have actually found it really helpful.
It's really great that it's going out in other bulletins. That's really good.
Well, what I'm doing is I'm putting it in layman's terms.
Oh dear, are we that bad?
No, you're not at all, because you can't be, because I understand it.
Tell us when we're using too much jargon, which we do all the time. Tell us.
I know. No, it's not that. It's because it's come from also someone. I've been around in Tor School now for 11 years.
Yeah.
You know, so I think something that's official but not official. Do you understand what I mean?
Yes. Absolutely.
So I just think it's breaking down barriers to get to those people.
It's not telling, is it? It's very much not telling people.
It's not, it's advising, and it's just, you know, well, have you had it? Well, yes, you know, and all my family have, and it's just a snowball effect, isn't it?
Yeah.
And you know, I know that a couple of people that after I spoke to them did get their jabs because they were really nervous about it. And just, I think it's someone, like, if your face is there all the time and they've got to know you and trust you, and I just think it makes a hell of a difference, because I'm just another person.
That is absolutely it. That's just what works, isn't it?
And that's why I think we do help so much, because we're not official, but we've got the know-how, we've got, you know, and I just think it's made a really good difference. And I think especially as numbers are going up, and with this variant at the moment, I think Torbay it's more personal this time, because we've had holiday makers, and because it's in the schools, and people are personally more getting it this time, because you know, I just think it's different. It's been ingrained now, wasn't it, for quite a while. I remember someone saying to me at the first point, and they said, "Oh, only be around for a couple of weeks." I said, "Give it a couple of years," and they looked at me and said, "Tracy, you're such a pessimist." I said, "I'm not." I said, "I've just got a bad feeling."
You are absolutely right. I didn't think it was going to last as long as it has.
Yeah.
No.
And I know lots of people that have said to me, well, I don't know anyone who's had it. And I think over the last few months, most people know someone who has, even if they've not been really poorly.
Yeah, 3 family members we've had who've died of it. You know, and sort of, I've got 3 of us that are very vulnerable within our household. So, you know, we haven't been able to take chances, and, you know, it has been a really hard slog, you know, for everybody, and nobody can say it hasn't affected their life one way or another.
No.
And I think now it's going on longer and longer. People are actually taking notice, where in the first lot they thought, oh, doesn't happen to us.
Yeah,
but it actually
we're all right down in the bay. It's not touching us down in the bay,
and we'll be fine.
Yeah.
So I think it's good. I will carry on giving out the information.
Excellent.
Because I think it's very important.
Yeah. Just got a couple of questions on the chat from Joe, asking about the workplace testing supplies ending. So what's going on with that? So that's confirmed that yes, by the on the 19th of July that will be ending, but you can still get the tests. The tests can still be picked up. You can collect the packs. If it's a large amount, if you want to email us in, Joe, with how many people are in your workplace, and all that information, we can pass it on to the right people for you and see if we can assist you with that.
Thank you.
But yeah, you can still collect the packs from the pharmacies and all of that for work. It's just that you won't be able to order it through the same system through the government.
Yeah. But could we pick up enough for like 100 people? That's what we're thinking. Or is it going to be?
The thing is that people can go and collect their own kits.
Some people will, but we've got it written in our policy that they test twice a week. So
Okay.
as it's in the policy, it's really the onus is on us to provide. And I know we, in the very beginning, we registered for the kits and they took ages to come through. So we purchased a significant amount of money as well.
Yeah.
So
Yeah, if you email us in with all the details, Joe, and I'll pass it on to Will, and he can see what he can do and see if he can get you some. As he might not be able to give you sort of all of those in one go, but he will help you as much as he can.
That's great, thanks.
Not a problem. There's a couple more questions, I think, from you as well, Joe.
Yeah,
Let me
there
just
is.
have a look. It's really difficult to comment on the track and trace because we don't have the control over track and trace, and that's done nationally. With the numbers that are coming in at the moment, you can imagine the numbers that are coming in nationally for them to do all the track and trace and contact everyone. It is really hard. A lot of the time, when you get a track and trace from a venue, it doesn't tell you where that venue was or who that person is. What we're finding a lot at the moment is they're coming in and people are then saying, well, I got track and trace 2 days later, and they're assuming it's the same, but it might not be. It might be from a different venue or from someone else. So it's really difficult for us to track down where that person's been track and traced from, because we don't have access to all the full systems. We're trying our hardest at the moment to get as much information as we can with these. We've had a couple of what we call venue alerts. So that is the QR code. So if more than 2 people have tested positive and used that QR code, we're advised. So it might not be that the venue's the issue. It just allows us to speak to that venue and say, you know, just to advise you, you know, we obviously don't give any information. It's just to say, make sure you keep up with your cleaning, and etc. But it is really difficult, and it is.
I think it's hard for the youngsters, like we're saying, particularly in the youngsters, it's going up. And I'll say it, my daughter's had a message. She's only been out Saturday night with 6 friends. They all QR'd in to only 2 venues. She's the only one that's required to self-isolate.
How has she been? Has she been told it's due to a venue that she went to?
I can't remember what she said.
Because if she's been, it may be that she's been named by someone who's tested positive.
No, she wasn't named. I'm pretty sure it was a venue. Yeah, venue.
Okay.
So it's like it's hard for her to state, like she's very, very compliant.
Yeah.
But now she's losing a week off work, and her friends who are in similar work are continuing to go to work. Her partner who was with her, she's like, they live in the same address. She's still out and about. You know, my daughter's saying, I can't even walk the dog because it says I can't go out the house. And it's like, it's ridiculous.
Yeah.
And when nobody else in the group has been called up, I can see why people are breaching that. And she's had a PCR test since, like she went yesterday and has the negative result. And I know that doesn't mean anything. And she does test twice a week because of her own work anyway. And when she got that, she tested as well, did another LFT test. But I can see why it's going up because of that lack, you know, the inconsistency. I would feel pretty fed up if I was out with my friends and I had to self-isolate and they didn't, you know, and I don't go out that much. So it doesn't affect me that much. But when you're younger, and things are just about to open up a bit more, and I can see how things are potentially spreading.
Yeah. Yeah.
The other question about the you've got one question about the guide posters, I think, was it? Oh no, workplace champions posters, wasn't it?
Yeah, because there was a while ago we were going to get champion posters for the workplace, or a champion sticker or something to stick up in work.
Yep, Eileen's done those. If you want to, I'm sure we've got your email details. I will.
I have emailed as well to request ones.
They were posted out a couple of weeks ago, so I'm not too sure. I'll check, Joe, and make sure you're on the list. And if not,
Thank you.
get one sent.
Thanks.
And the immune thing about if you've got a compromised immune system
Yeah.
and about having flu and COVID boosters are close. I think we don't have information yet on this because we don't have a definitive program yet saying
Right.
when they're going to be given and how close together. But I'm sure there will be. So we'll make sure that comes out in the bulletin. There will be guidance, but it's not available yet.
I know there's obviously several trials going on, isn't there, at different hospitals for different things on boosters and things like that. So hopefully in the next few months we'll get some more information out. And
Yeah, go on.
It sounded like in a general way it's okay to give them both together, but I don't know specifically about the compromised immune system. But there's also an issue of supply and timing. So it may be that the first people who get flu vaccines get it before they get their booster or the other round, just because they need it, and at that point it doesn't fit with the other one. So it may be that, just to be practical, they get them at separate times.
This
anyway.
person was really worried that they were going to just have, they never have the flu vaccine because it makes them so poorly.
Yeah.
But they've had the Pfizer very early on because they're like 85 with leukemia, and they were fine, fell asleep for about 5 hours, and that was it. So yeah, very keen to have the COVID booster, but not the flu. And she was worried that it was going to be both in the same syringe, or
it won't be in the same syringe,
or both together, and it'll be like, no, I don't want one, and it really not have the choice will be taken away. That's what they're
you have to give consent, so you could say yes to one and no to the other. They wouldn't give it as a cocktail. And there should be information coming about specifically, and also GPs will get information so that people, so there will be stuff and there will be choice.
Good. Yeah, okay, thank you.
Someone else is agreeing
2
with you.
weeks apart. Yeah, thanks. Eileen.
Anything else? Anyone else?
I don't think I had anything to say.
We just cheer each other then.
Yay!
Well done, everybody. It's been great, and thank you. But we haven't finished. We'll keep going.
Right. Thanks, everyone.
Thank you. Yeah, and thank you. We'll keep in touch, and we'll get the bulletins out to you and any information that's coming out. And we just want to thank you all for all your support.
And have a good summer.
Yeah.
Yeah. Have a good summer.
Stay safe. Bye.
Thank you. Bye.
Bye.
Bye.